Yes. So just quickly, we'll go through the ground rules. So we'll go through the ground rules. So to avoid background noise, I would appeal to you to mute yourself if you are not speaking, so that we don't disrupt the speaker. So if you can mute yourself, if you are not allowed to speak, please. Then the session will have a Q&A session after the presentations where you can ask questions, and the guest speaker and other panelists will be able to respond. If you wish to make a comment or ask a question, you can do this by using the raise hand icon, or you can put your questions in the chat box, and at the end, we'll collect the questions, and the guest speaker and other panelists will be able to respond to them, or probably as we're looking at them, we'll be responding to them accordingly. Again, if you want to speak, use the raise hand icon and I'll mute you so you can make your contribution. You can also post your comments and questions in the chat box. And like I said earlier, we're going to review the questions during the Q&A session. So just quickly, I will take you through the agenda, which is to welcome you all and explain the ground rules. And I'm going to introduce the panel who will be leading discussions today, and we'll have a brief intro of the BBCSI and the awareness campaign. And our guest speaker would lead the talk and presentation on early detection saves lives. And we have personal stories from some of the survivors, and then we'll end the Q&A session and we'll wrap up. So our chief host is in the person of Professor Stevina Evuleocha-Ugbah. She is our chief host. Just a brief background to her profile. She is a Professor Emerita of Marketing and Entrepreneurship at the California State University, East Bay. Dr. Evuleocha is also a breast cancer survivor, founder of the Benue Breast Cancer Survivor Support Group. Dr. Evuleocha is passionate about dismantling the culture of secrecy that surrounds cancer diagnosis, especially among people of color, and the gross misconception that a cancer diagnosis is a death sentence. I would like to welcome Professor Stevina Evuleocha-Ugbah. Prof, you're welcome. And we have our guest speaker, Professor Andrea Onguze, who is also with us here today. Professor Andrea Onguze teaches, this is, just a second, I want to be sure I call the terminology correctly, in the OB and gynecology at the Benue State University, Makurdi. She holds a BA Hons in drama, Masters in Business Administration, MBBS, from the prestigious University of Ibadan, Nigeria, as well as fellowships at the West African College of Surgeons and the National Postgraduate Medical College of Nigeria. She is actively involved in postgraduate medical education in the West African sub-region as an examiner with the 2 postgraduate colleges. In her service to society, she has been head of clinical services at the Federal Medical Center, Makurdi, Nigeria, from 2004 to 2008, and pioneer director of the Benue State University Health Services from 2012 to 2017. She has written several articles in peer-reviewed journals, as well as book chapters. Her areas of interest are maternal fetal medicine and gynecological cancers. Prof, thank you for joining us today.
Thank you very much. Glad to be here.
Thank you. And we have one of our panelists who is here with us today, Mrs. Ngoho Hanaktion. She holds a postgraduate diploma in management, and previously she worked with the then Benue Cement Company PLC, now Dangote Cement, and she has also worked with Diamond Bank. I think now it's Access Bank. She is currently into farming. Mrs. Hannah, you're welcome. So at this juncture, I would pass on the stage to Professor Stevina Evuleocha-Ugbah, who will then give us an overview of the Brainwave Breast Cancer Group. Madam, over to you, please.
Thank you to our moderator, and welcome to all our friends who are joining this Zoom event from different parts of the world. A big shout out to our friends at the Volgograd State University, Medical University, who are also joining to participate today. Special welcome to our special guest who has agreed to talk to us about early detection. Without further ado, I would like to start by giving you a short synopsis of the Benue Breast Cancer Survivor Support Group. But before I get to the history of the group, I would like to talk a little bit about support groups, especially for breast cancer, and what they do for those who are afflicted with the disease. Breast cancer support groups are generally gatherings of people who have a history of breast cancer and individuals who are interested in the disease itself. They could be interested because they have family members who are suffering from breast cancer, or they could be interested for all kinds of other reasons besides that. Granted, cancer survivors may have support from family and friends who are in their orbit. However, joining a support group has its own special benefits for the survivor. Research even supports joining a support group for the disease as one of the ways to improve quality of life, as well as perhaps improving your survival rate. So for our purposes, I will talk a little bit about some of the outstanding benefits that can be gained from being in a support group. Later on, when we tell our survivor stories, I will talk about how support groups have helped me at different stages in my life. But some of the benefits of being in a breast cancer support group includes being connected to others who are experiencing similar problems, getting tips and information from people who have gone through the process and who are willing to share their stories and help you through the process. And finally, of course, as a survivor, joining a support group gives you an opportunity to help others and also to perhaps inspire them to believe that the disease is not one that will take them out sooner than they have to go. And obviously, it's that whole feeling that cancer is something that we don't talk about, especially among people of color. Joining a support group allows you to know that you're not isolated and that you can share your story and hear how others have handled problems like that. So, of course, what is now known as the Benue Breast Cancer Survivor Support Group started in 2016, 3 years post-diagnosis for me. And 3 factors influenced the start of this support group. The first factor was the change or adjustment to the calendar by the president of the Mutual Union of TB in America, who was organizing a medical mission to Benue in the summer of 2016. So with that adjustment to the calendar, I was able to join the team that went to Benue that year. Secondly, I also will attribute the reason for the presence of this support group in Benue to the tireless efforts of Mrs. Ngomoga, who went around looking for breast cancer survivors ahead of our visit to Benue. And then finally, our group probably wouldn't have had that shot in the arm if it wasn't for the generous donation that we received from Mrs. Jennifer Milne, who is co-owner of Mazel's in Pleasanton, California. A shout out to Jennifer if she's on the program today. Jennifer and her mother and daughter run a 3-generation company that provides help to patients pre-cancer and post-cancer. So in 2016, they donated a suitcase full of prophylactics, bras, and camisoles that I took to Benue, and that launched our survivor group, and support has gone on from then up till now. In fact, in speaking to her recently and telling her that we're having this Zoom meeting, she says that she may have things to give to the women in Benue. So I look forward to visiting her for this purpose. So since its inception, the Benue Breast Cancer Survivor Group has actually been doing awareness campaigns in person. As the moderator indicated, 2020 was the first time that we did a virtual awareness campaign. And of course, most people know why that is. With the 2019 COVID pandemic, and it really didn't make sense to expose our members to COVID by having them go in person. And so in the past, we have taken to do awareness campaigns, one local government at a time. This year and last year, we did a virtual awareness campaign, and our members went out to do walks and asked people to support their walking. But in addition to our annual awareness campaign, the Benue Breast Cancer Support Group has done a few other things that are worth mentioning. Most recently, we started providing microloans for members of this group who are interested in starting small businesses. In addition to that, we matched funds for one of our members who had to go through radiation therapy. And it was quite a very breathtaking event for us because that was our first major fundraiser for a member. We also try to provide emotional and visitation support to members who are going through different treatment protocols, as well as members who are deceased, who the group goes to support their family. We have collaborated with different groups in Benue that share our vision of making cancer a thing of the past. And also recently we began registering the support group with the Corporate Affairs Commission so that we can legitimately begin to fundraise and do other projects. Very recently, we were approached by a non-member who needed support, financial support. We were able to assist as best we could this non-member who came to us. And it is really with a heavy heart that I inform this session today that that woman, Mrs. Christy Kumba, passed away 3 days ago, did not survive her treatment protocol. And for Mrs. Kumba and all our members who have died since 2016 when this group was formed, with the permission of the moderator, the guest speaker, and everyone, I would like for us to observe a moment of silence. Thank you all for that respect of the folks who have passed on. The Benue Breast Cancer Support Group still has a very long way to go to achieve the primary goal, which is to create enough awareness of breast cancer among women in Benue that most of them will actually see early detection as that proverbial stitch in time that saves 9. I look forward to the day that, of course, cancer will be eradicated from the face of the earth. So without further ado, I wish to hand this over to our moderator to continue with the program. Thank you all for joining us today.
Thank you very much, Professor Stevina Evuleocha-Ugbah, for talking to us about the Benue Breast Cancer Survivor Support Group, and the history and this progress you've made to date. So we are moving on to the next segment of our agenda. I would like to request and invite our guest speaker. I'm sure you want to share your screen, perhaps if you want to begin the process, to invite our guest speaker for today, Professor Andrea Onguze, who will be giving us a brief presentation on the theme, Early Detection Saves Lives. So welcome you, Prof.
Yes, I'm just trying to get it.
Okay, yes.
So while that's opening, I'm Professor Andrea Onguze, Professor of Obstetrics and Gynecology and Chief Honorary Consultant with the Benue State University, as well as the Benue State University Teaching Hospital. I wish to take this opportunity to thank the chief host for inviting me to be part of this presentation. I've been asked to talk on breast cancer, early detection saves lives. And I'll be using this outline to do my presentation. We'll look at learning objectives and some breast cancer statistics, and then define what breast cancer is, then look briefly at the anatomy and physiology of the breast, and try to find out what causes breast cancer, the genetics associated with breast cancer, as we then look closely at early detection and the concept of breast self-examination. At the end of this presentation, we'll be able to discuss how common breast cancer is, to define breast cancer, name 2 most common risk factors associated with breast cancer, and know breast self-awareness, as well as name at least 1 action item associated with breast self-awareness. Currently, breast cancer is the most common type of cancer worldwide, both in the developed and the developing world, with 2.3 million cases recorded in 2020. In 2020 also, it was the 5th leading cause of cancer deaths worldwide, with 685 deaths attributed to it. So this works out to every 50 seconds, somewhere, someplace in the world, a woman dies from breast cancer. It is now the commonest malignancy affecting women in Nigeria. Locally, at Benue State University Teaching Hospital, of 249 histologically diagnosed breast lesions, 114, that is 46% of them, were malignant, that is, they were breast cancer. Eke et al. And what is breast cancer? This is a disease where cells in the breast tissue divide and grow without normal controls. If you look at this slide, this is a normal tissue with cells well dispersed, with new cells being created to replace dying ones, and this keeps the body organs healthy. And on the right here is a pictorial representation of a cancer cell. These are abnormal cells that outlive normal cells and just continue to form in large numbers. They are sort of immortal unless they are killed off. We'll look briefly at the anatomy and physiology of the breast. So the breast is made up primarily of fat and breast tissue. And the breast tissue rests on muscles called pectoralis major muscles. It's made up of the complex network of lobes, and ducts. And this drain, this lobes and ducts drain into the nipple. And the breast undergoes many changes over a woman's lifetime. Currently, we do not know what causes breast cancer, and so we don't know how to prevent it. But genetics have shown that there are genetic mutations that occur. These are changes in an organism's DNA that may be spontaneous or inherited. And several inherited mutations have been linked to breast cancer, specifically BRCA1 and BRCA2. And of these inherited mutations, the prevalence of the general public are 1 in 400 to 1 in 800, with 5 to 10% of breast cancer cases being linked to inherited gene mutations. Early detection has a lot of advantages because it gives room for effective treatment, which offers the best chance of survival. And as a case in point, breast cancer mortality has been shown in the United States to have declined by 40% between 1989 to 2017. And what is the concept of breast self-awareness? By this concept, a woman is taught to know her risk, get screened, to know what is normal for her, to make healthy life choices. And knowing your risk involves talking to both sides of your family about your family health history, like disease entities like hypertension and diabetes, and indeed breast cancer, as well as cancer of the ovary, cancer of the colon, run in families. So if you talk to both sides, both your father and your mother's side of the family, you'll be able to know whether one of your relatives had this cancer. And if you have found a relative that had developed breast cancer, it's good to talk to your doctor about your personal risk of developing breast cancer. And what are risk factors? They do not necessarily cause breast cancer. They are associated with an increased chance of getting breast cancer. And some risk factors can be controlled while others cannot be changed. And the two most common risk factors for breast cancer are being female and getting older. Other risk factors include inherited genetic mutations, as I said earlier, hyperplasia of the breast, this is overgrowth of breast tissue, positive family history of a relation having breast cancer. Having dense breast tissue has also been associated with developing breast cancer. High blood estrogen levels, the previous history of breast cancer may tend to have a recurrence. Then having no children or having the first child after 35 years of age, being overweight or having adult weight gain, then drinking alcohol has also been associated with breast cancer. Having a first period before 12 years or late menopause after 51 years. Then engaging in sedentary living, that is no physical activity at all, or not breastfeeding. In our environment, some common misconceptions include that breast cancer is a punishment from God, or a pessimistic resignation that the patient just feels what will be. And sometimes the woman feels a lump in the breast, but thinks that it needs to be looked at only if it becomes painful or goes larger. Then another misconception is they may think it's caused by a blow to the breast, or that it's caused by rough handling or biting during breastfeeding. So when we talk to your doctor about screening tests, which screening tests are right for you if you're at a higher risk of developing breast cancer, then the doctor might advise you to have a mammogram every year starting from age 40 if you are at average risk of developing breast cancer. Or you can have a clinical breast examination at least every 3 years starting from age 20, or every year from age 40. These are ways to getting screened for breast cancer. And mammography is a radiological examination that is the best screening tool available now for finding breast cancer early. The mammogram can detect the breast cancer even before the patient can palpate or feel a lump in the breast. a woman is under 40 and has a family history or other concerns, you should talk to her doctor about having a mammogram. And then the mammogram can be used as a diagnostic test for women and indeed men too at any age, because it's been shown that about 1% of men may also develop breast cancer. So it's not limited to women. Another way of detecting breast cancer is to have a clinical breast examination by a healthcare provider at least every 3 years, starting at age 20, and every year after age 40. And the healthcare provider is trained to inspect the breast, looking for disparities, or rashes, or changes in shape or contour. Then they will also palpate the breast to feel for lumps during the clinical breast examination. Then knowing how your breast looks or feels like and reporting changes to your healthcare provider. So if you are used to looking at your breast in the mirror, and also doing self-breast examination, you'll be able to feel or see when there are abnormal changes that need to be reported to the healthcare provider. And these are some of the abnormalities that one can find in the breast. You may find a lump underneath the breast itself, or in the underarm area or the axilla. You may find a change in the shape, like this breast is riding higher than the other one. You may find swelling or a darkening on the breast, or redness or warmth. Then you may find deep dimpling or puckering, or what you call the orange skin appearance on the breast that may also correct the more sinister thing going on underneath. Then the breast may become itchy with scaling or soreness or a rash on the nipple. There may be a nipple discharge that starts suddenly. You are not breastfeeding and all of a sudden you start discharging either clear fluid or milk, or worse still, a bloody discharge. Or the breast may be, the nipple of the breast may become pulled in. Usually the breast nipple is everted, that is pointing outwards, but when it becomes retracted inwards, it's a sinister sign that you ought to check in with your healthcare provider. Or you may start experiencing new pain at a spot on the breast that does not go away, even when you take analgesis. What makes for healthy lifestyle? You can maintain a healthy weight, or deliberately add exercise into your routine, and limit alcohol intake. Then if you are postmenopausal, you can limit the use of hormone replacement therapy for menopausal symptoms. Then if you are still in the productive age, you can breastfeed, which is known to be protective against breast cancer. To recap, for breast cancer self-awareness, breast self-awareness, you need to know your risk by talking to relations. You need to get screened by either radiological mammography, or getting your healthcare provider to do a clinical breast examination for you. You need to know what is normal for you, so that once you notice a change, be it a lump or a rash or a discharge, an abnormal discharge, then you go for further assessment. Then you have to make a healthy life choices, deliberately work exercise into your routine, maintain a healthy weight, limit alcohol intake, as well as hormone replacement therapy for postmenopausal symptoms. So at the end of the presentation, you should be able to discuss how common breast cancer is, define breast cancer, name the 2 most common risk factors for breast cancer, and know the concept of breast self-awareness. Be able to name at least 1 action item associated with each breast self-awareness. Thank you for listening. And this resources. And these are my colleagues that helped with putting together the presentation. Thank you.
Thank you very much, Professor Andrea Onguze, for the presentation on breast cancer in terms of awareness, detection, and other information that I think we'll find useful. Myself, I found the presentation very useful. Thank you very much. I know we have questions for Prof, but I would just like to ask you to hold on to those questions. If you wish, you can put them in the chat, but hold on to it so that we just follow the agenda and we have sufficient time for the Q&A session. The next item on the agenda is the personal story or personal stories by Professor Stevina Evuleocha-Ugbah and Mrs. Hannah Tion. So I would leave the floor now for Professor Evuleocha to share her own personal story with the audience. Prof, you're welcome.
Thanks again, and thank you so much to our special guest for quite a wonderful presentation. And obviously, speaking to the fact of early detection, I happen to have had that benefit of early detection. For my experience, it was one of those instances where we were not even looking for something and you found it. And it was initially, something that I attributed to be perhaps because I was ovulating. So I said, okay, I'll wait and check again the next time I take a shower. And lo and behold, the lump was still there. Subsequently, I made an appointment to have myself examined. And of course, I was told that the lump was malignant. One of the first things that I did upon getting this news was to go online. And what I typed in was early cancer diagnosis. Of course, I had no experience with breast cancer support groups or the like, but I was stunned with the sort of environment I found online. There were discussion boards, there were all sorts of chat environments where women were literally helping each other to cope with the disease. And what was subsequently quite heartwarming for me was to read about women who were in advanced stages of the disease and who were on those discussion boards encouraging newbies like me and telling them, oh, you'll be fine. And some of them said things like, I've been fighting breast cancer for 15 years. They gave me 2 years to live and I'm still here fighting breast cancer. I mean, you can imagine. This was even before I took the first step to have the treatment protocols started. So right there and then, just from doing that Google search, I was empowered, essentially. And to me, there was no way I wasn't going to pay it forward, because how else can I use that except to now tell people that breast cancer is not a death sentence. Now, if you think about the non-communicable diseases that irk the people on this planet, there are diseases that are more common than cancer, that take people out without any warning. While there is no cure for cancer, the chances of survival is very, very high in 2021, mostly because advances in medicine now make it easy for people to live longer with the disease. Just like when HIV/AIDS came out and took out a whole lot of people. So there are going to be pioneers who are not around for the cure. But if you're living in this time and this age, one of the best things that you can do for yourself is to check yourself often. And my story is one that I can't stop telling, because if it wasn't for me paying attention to my body and observing that lump, it's not clear how long it would take before I would have known that I was afflicted with the disease. So for people who are on this platform today discussing this issue, either here to learn for a friend or to find out in general, please tell the story that breast cancer, when detected early, increases the chances of survival. Now, to tell my story further, when I came out from those discussion boards, the one thing that I took away with me was that I needed to do a lot more research about breast cancer and to also be able to stand by to help others who are afflicted. So throughout my treatment protocols, throughout the steps that I went through, what I knew that I had to do was to reach out to my network. Everyone that I knew that I had their email, I summarized what was going on with me, and I sent that email out and I said to them, this is what's going on with me. Please pray for me. Please support me the best way you can. And guess what? Subsequently, I got to hear from friends of mine who were in radiology, in oncology, sending me articles, sending me information, advising me on what to ask, the kinds of questions to ask when I meet up with either a radiation oncologist or anybody who was in the process of that treatment protocol. That was information that was invaluable. So keeping a diagnosis secret doesn't change the facts. In fact, if anything, there is more research to prove that sharing your diagnosis actually will keep you alive longer than hiding your diagnosis. And if you can, perhaps look at how foolish it will be to hide your diagnosis. Let's say, let's take for example, an instance where somebody gets a breast cancer diagnosis and they tell one person, and they tell that person, you know what? This is between you and me. Don't tell anyone else. Guess what's gonna happen? They're gonna turn around and tell 100 of their close friends, and they will say, oh, she doesn't want anybody to know that she has breast cancer, so please don't share. Meanwhile, there are 100 people who already know that you have breast cancer. Breast cancer thrives on stress. The first level of stress that can be removed for the breast cancer patient is the stress of hiding the diagnosis. So if especially people of color can get on board with being open about their diagnosis, it will save lives, it will improve their survival, and it will also help others who don't know where to go when afflicted by breast cancer. So this is all to say that the culture of secrecy that we practice, especially among people of color, it needs to really, really go away. So just 8 years later, I am still here, as some of those women on those discussion boards here said, making sure that I do my best to contribute to making cancer a thing of the past. I thank you for listening.
Thank you very much, Prof. Very heartwarming story, and thank you for the encouragement and for coming out to share your story to encourage others to kind of like check up themselves, try as much as possible to see if there is any problem, speak out. And again, you are a living testimony, so we thank you for being that person and for coming up with the group, the Benue Breast Cancer Survivor Group, to support others who may have experienced or are experiencing this problem. I'm not sure if Mrs. Hannah is on now. Mrs. Hannah, yes, you can unmute yourself. Yes.
Yeah, I'm on.
Okay, Yes, so you're welcome. I'm sure you also have a personal experience you would want to share with our distinguished audience. So over to you, Mrs. Hannah.
Thank you very much. I want to thank everybody that has joined us in this year's campaign. My story is not quite different from Prof's story, but the difference there is that the environment she found herself in was quite different from mine. She was in an advanced place and she was able to handle her own that way. Here, it was not as easy as she could find people to help her. You know, I too noticed my own true self-examination. They used to tell us as a woman, you have to be examining your breast to see if there's any lump there. So on this fateful day, I was checking my breast and then I noticed a lump, very small. And luckily for me, Professor Nguze was my personal doctor. So I rushed to her and showed her that this is what I have seen in my breast. And she now examined me and directed me to go and see a surgeon. According to her, the surgeons specialize in tumors, so they may be able to explain it better to me what was going on with me. So I went to a surgeon and then he checked, and unfortunately for me, I was not handled properly. They took me to the theater immediately, removed the lump, and then didn't handle it well. And they gave me to take to a lab, a laboratory that was outside the hospital. And by the time I took the sample there, it was already bad. So they couldn't get the correct result. And when the result came out, it was not the correct result, and they told me to wait. So I waited for like almost 1 year. They told me there was no problem, so I now relaxed and thought that actually there was no problem. After 1 year, instead of having my breast back normal, it was not normal, it was getting harder. So I now went back to the doctor and showed him what I was seeing. After checking me, he himself was shocked on what he saw. So I thank God. God really was on my side, and they did the procedure again in taking the sample and taking it to the lab again for the second time. And this time the result came out malignant. Now, the first thing I felt, I was angry, not because they told me I had cancer, I had breast cancer. I was angry because the doctor didn't handle me well, you know. But then a voice told me that because the Bible tells us that for every situation there's good into it. So I now consoled myself and said, "So God knows why I have to go through this." So the first step that I used in overcoming the situation was to accept it. I accepted the situation and I was ready to face whatever will come with it. So I now went out and started the treatment, you know. And the environment, as I was saying before, even my doctor told me that this thing, you don't need to go and start browsing and learning so much. If you know so much about it, it will become a problem. But in her case, she had to go online and study so much about the disease so that she will know what it entails. But here I was discouraged from reading so much on it, you know. So I went through the treatment. It was hectic, but God helped me. And because it was early detection, even though they wasted my time, it was still within the level they can still fight it. So they went ahead. I'm getting to 10 years now. It started in 2011, and I started treatment in 2012 after wasting a whole year. But by God's grace, I'm okay. I'm fine. No problem. So I encourage everyone, go ahead, check your breast. Early detection is the key. If you allow it to go far, it becomes a problem, a bigger problem. So if we detect it early, it can be handled, as our doctor was saying. So I will encourage, and as Prof was saying, If you hide it, even the Bible says that if you hide your sins, you will die from it. So it's better to tell people about your problem. Maybe somebody will be there to help you. So don't hide, come out. And that is what we have been fighting for. We have been campaigning. Don't hide. Identify with us. We are part of you. So if you know anybody that is suffering from it, let the person contact us. We are always ready to reach out to the person. If it means visiting, we'll go and visit the person and encourage the person. That is what our group has always been doing since it started. We go out to people who are down, because once they hear that I have breast cancer, they know that they will start thinking that that is death that has knocked on my door. But we tell them, no, it's not true. You can still fight it. With God on your side, you will make it. So thank you very much for listening to my story. That is all. Thank you very much. And okay, maybe you give me another chance to.
Yeah, go on. No, sorry, go on while you have the floor.
No, I wanted to say that since the inception of this our group in 2016, we started with a number because we were able to mobilize those people that were affected with the disease. We were about 12 when we started. Then the number kept increasing, and from that time to date, we have lost 12 members. We lost Mrs. Akpereshi, Mrs. Agirigi, Mrs. Akume, Mrs. Anya, Margaret Anya, Esther Adagi, Mrs. M. Ajegba, Ladi Opanachi, Mrs. H. Ekene Helen Ekedegba, Mrs. Iji, Judith Iji, Mrs. Priscilla Yofa, Mrs. Munategba, and right now we have our sister, Mrs. Christy Akumba, who is yet to be buried. So we have already observed 1 minute silence for them. So that is how far we have gone. Thank you very much.
Thank you very much, Mrs. Hannah Tion, for sharing your story, which is also similar to Professor Stevina Evuleocha's story. And I think the summary of what both of you have said is, if we can survive it, you too can. And the key is early detection. Just quickly before we go on to the next segment, which is the question and answer session, I just want to go through the chats quickly. We have our friends from Volgograd State University. We want to acknowledge their presence. Thank you for joining. And we have a comment here from Ladi Swende to Professor Onguze. She says, that was a great presentation and very educating. Thank you. And from Natalia says, thank you, dear Stevina, for the invitation. 1 second, for the invitation. You are really a wonderful person. You are doing very important for the women, or rather, you are doing really very important for the women. Thank you. And then I have a chat here from Dr. Moyo. It says, good evening all. My younger sister lost her 8-year battle with breast cancer exactly 9 years and 5 days ago. She was 2 weeks shy of her 45th birthday. She left 3 beautiful girls behind, now 28, 25, and 13. What are the best recommendations to have them tested? Being at a higher familial risk? Are the 2 older ones old enough for mammogram? Thank you. And then we have BC again says, I like the part where Mrs. Tion said she accepted the situation and it helped her mentally to deal with the situation. Yes, so thank you very much. And these are the comments. So I'll leave it open for the panelists. Professor Andrea Onguze, Professor Stevina, over to you, please.
Okay, I think our special guest can address the age question in terms of the daughters who need a mammogram, and I can come in after her. I think the question
Yes,
was okay.
Yeah, the ages of the two daughters, age 25 and 28. Yes, those can have yearly clinical breast examinations and go for mammography, because above 20, it's recommended that one could have clinical breast examination every 3 years, but they are in a high risk group. Their mom has died of breast cancer, so they can go ahead and have a yearly breast clinical breast examination as well as mammogram, because the mammogram is more sensitive. It picks lesions or lumps before the patient can even palpate them. Thank you.
Absolutely.
Thank you
I
very
will
much.
only just come in very quickly to say that in addition to Dr. Oguze's recommendation, they should also definitely do other things that can help them with avoiding breast cancer. Obviously, like the good doctor said, no one knows what causes it, but we can do our little level best to improve our chances of not getting it. So look at the literature, some of the things that suggest that you could. Literally everyone on earth has cancer cells. It's a question of when they choose to manifest.
It's not normal, but it's
So some of the things that people who are currently not afflicted can do include diet, exercise, as well as lifestyle. Lifestyle, Dr. Ngoze mentioned some things as avoiding alcohol, or perhaps drinking reasonably. But you do have to practice some of the things that would help also to reduce the genetic combinations. But also key to some of what we're saying today is that in 2021, you don't have to have a family history of breast cancer to get breast cancer. In fact, the incidences are increasing among people who don't have a family history of breast cancer. So everyone is at risk and should take precautions by doing the needful. Make sure you're watching what goes inside you. In other words, watch what you eat and what's eating you. Reduce the stress in your life. If something is going to cause you not to sleep at night, perhaps turn it off and forget about it. And of course, exercise as much as you can. Thank you.
Thank you very much. And there's another question here from Fumi. It says, I learned there is a pre-lump stage. What tests can be done to detect at that stage?
I guess pre-lump stage is referring to maybe a carcinoma in situ, an early stage that one can detect. To find they do aspiration biopsy and sending the tissue or specimen obtained to the lab for the pathologist to analyze and interpret. But pre-cancer stage means it's not yet a cancer, but it has a potential to evolve into a cancer.
Absolutely. And some of it can be what they call calcifications, which don't show in the form of lumps. They just like the doctor said. And in those cases, if the individual has not gone through cancer, then maybe they can treat it without having to remove the breast. But if they have already gone through a previous session, then the only option left would be for the breast to be removed.
Thank you very much. And we have one question here in the chat again. It says, if we can modify in a gene BRCA1 or anything, are we going to get good results? And the second part of it is, what is the role of scientists in this topic?
That one will definitely go to the doctor herself.
Research is ongoing. And scientists have not found a way of modifying the genes. You know, these are naturally occurring and inherited. You know, so, but there is a project called the Human Genome that they're trying to chart people's DNA, and research is still ongoing to find out which ones will cause cancer and how this can help the pharmaceutical people to come up with drugs to cure the various cancers detected. So the BRCA gene is inherited. It's not modifiable, but we're.
Thank you very much, Prof. So we're almost coming to the end of the session, so we can take one or two more questions before we wrap up. And if you have any questions and perhaps maybe you can't locate the chat box and you want to unmute yourself and then speak, that is also welcome before we bring the session to a close. Yes, I have Scholastica's hand up. Yes, please. You have to unmute yourself to speak.
Okay. Good evening, everyone.
Good evening.
Good evening.
Good evening.
Oh, you're on mute again, Scholastica. Yes.
Thank you all for joining. We appreciate you. I'm a member of the Benue Breast Cancer Survivor Support Group, and we were excited holding this.
Scholastica, we've lost your audio.
We appreciate you all, and we hope you are to help us create more awareness. Courage. So many young girls, so many older women, so many people every day gets the breast cancer diagnosis, and we just wonder what's happening. We just wonder, and of course, when they get it, they're broken. It's difficult to console them because so many things are imagined. Is it death that is nearby? How do I take care of myself? How do I do this? How do I do that? So it's better to prevent, and prevention, of course, they say is cheaper. So the awareness creation is an opportunity. We appreciate the medical women who had the march around Makurdi a few days ago. And in a various little ways, we can continue to contribute to this message being spread across the communities. The women should stop hiding. They should come out. We may not have the money to cure them, but we may have the education to give them. And we can also help our young girls. Let them be aware of the breast, study their breast, and know when the issues begin to arise in good time, so that we catch everything early and prevent. I get so upset and so worried when they come to present almost at a time when there's no help. So people are more conscious just the way they prevent any other sickness. And they want to also work towards preventing breast cancer. I believe it will be cheaper and it will be less traumatic. Of course, it's expensive treating the disease. It's quite expensive, no doubt about it. So yes, we really want to have as much education across communities. We, the Breast Cancer Survivors Group, are available to go around with you and educate and strengthen women that yes, you can survive. It's not a death sentence. Yes, you can survive, even if you get afflicted with breast cancer. Its survival chances are higher when it's detected early. So we look forward to more partnerships and more opportunities to work with communities and friends and all women groups to strengthen the faith of women that yes, it's possible to survive. Thank you very much.
Thank you very much, Scholastica Land. Thank you. And we have BB's hand up. Yes, BB, you will unmute yourself and speak. Thank you. Yes, BB. Sorry, we can't. We can't hear you, BB.
Can you hear me now? Can you hear me?
Yes, yes.
Okay. So I'm just coming from the point of view of, just trying to encourage people to come out and check themselves. Like we are very, very religious, especially in Nigeria. People feel like, oh, it can't happen to me. It's not my portion. I'm the child of God. God loves me, and all that. So it just occurs to me that I should share this. Many of us feel like, oh, it can't happen to me. Oh, I'm a child of God. But God takes nobody. People who have died of cancer, God doesn't take them. People who are going through it right now, God doesn't take them. So it's for us to move away from that over religiosity, trying to deal with things, I don't know, but to come out and accept the fact that even diagnosing early is also help from God to allow us to be able to go through it. So that's just what I want to stop here. Thank you very much for the opportunity to share.
Thank you very much, BB. Just to reiterate what she has said so that others can hear very well. She says, in Nigeria, sometimes we are very religious. We want to shy away from reality. And so when things like this happen, we say, God forbid, and we just think it can't happen to us. But she says early detection is also a way that God is telling you to go and begin to get help. And so we shouldn't be over-religious about these things. They are real. And of course, not neglecting the power of prayer, but let's also get help. Let's come out. Let's seek the required help where necessary. So thank you very much, Bibi, for that contribution. Yes, and thank you. And now we'll move forward, and I would like to invite Prof again, Professor Stevina, for you to just wrap up.
Thank you to our moderator, and thank you all for attending. I will not fail to acknowledge a couple of people that I have noticed on our forum today. I would like to do a shout out to Her Excellency, the First Lady of Kebbi State, who joined us this morning. Hajia Aisha Bagudu is with us today. And also to the Provost of the Volgograd State University Volgograd State Medical University, Natalia Ashok. Dobrudien, where you are. I thank also all those who contributed financially to our campaign this October. We look forward to more partnerships, and we definitely are here for the long haul to help create awareness and to make sure that people fail to believe some of the myths that Dr. Onguze has talked about. Breast cancer does not happen because of witchcraft. Breast cancer was not because your in-laws don't like you. Breast cancer is not because God doesn't love you. Let's start from today to demolish all the myths surrounding breast cancer. And if you joined us today from wherever you are, please help us with this awareness campaign so that we can finally eradicate breast cancer from the face of the earth. And finally, and more importantly, breast cancer does not afflict only women. There are men who are going through the disease, and it's actually perhaps the worst secret among people of color, because it's already bad that the women get it and to have a man have breast cancer. So if you have a male person in your life with breast cancer, they should also be checked out. Let me conclude by saying a big thank you to our special guest, Dr. Andrea Onguze. We really appreciate you and thank you for the wonderful education. Thank you, Mr. Moderator. I always am honored by the fact that every time the Benue Breast Cancer Survivor Support Group calls on you, you're there for us. Thank you very much. And goodbye from here.
Thank you. So before you are not going yet, please, because there's another question. The idea, the purpose of this workshop is so that everyone leaves with something. So another question has come in. I know we're wrapping up, but I think it's an important question that I would want them to go with an answer if possible. It's from Stephanie. It says there is an opinion that exposure to the X-rays in mammogram machines can stimulate breast cancer cells. Is this true?
Okay, Doc, take it over.
Yes. In medicine, we try not to do more harm than the patient came in with. So if the patient comes in with a serious diagnosis that you are suspecting a cancer, and the radiation in a mammography is not at the level that should stimulate more cancer. Otherwise, we would have had an epidemic of breast cancers from people getting screened using the procedure. So where you have a high suspicion, then you aim not to do more harm than the patient came in with. And scientists have researched into the level of radiation that one is exposed to at mammography, found it to be safe for use. That's why it's used as a procedure for screening, as well as diagnosis. Thank you.
Thank you very much, Prof. And I hope that clarifies the question. So thank you. And I would also like to invite Mrs. Hannah Tion to just give us her closing words as well.
Yeah, yes. Can you hear me now?
Loud and clear.
Okay. I want to thank everyone for being there with us, for us and with us. One other thing I remember I want to say is when they say you have breast cancer, many people come to you. Hey, don't go to the hospital. I have something that can take care of that. You don't need to go to the hospital. Please, I'm begging. Don't allow anybody to fool you. Go to the hospital, let the doctors do their work, and God will take care of the rest. So thank you very much for being with us. God bless you all.
Thank you. I just want to use this opportunity to thank the founders of the Benue Breast Cancer Survivor Support Group. Thank you for always involving me on your virtual programs. I want to use this opportunity to thank our guest speaker, Professor Andrea Onguze. Thank you for joining us and for sharing that very wonderful presentation, which I believe a lot of people have benefited from. So thank you very much. I want to thank the chief host, Professor Stevina Evuleocha-Ugbah. Thank you. And also thank Mrs. Hannah Tion and Scholastica and the rest of the Benue Breast Cancer Survivor Support Group. You are doing a great job. And our distinguished ladies and gentlemen that have joined, thank you for leaving your busy schedules and joining us here. Without you, we'll just be here chit-chatting with ourselves. So thank you very much. And just to summarize, the theme is early detection saves lives. That's one. And then two, the people who have shared their personal stories here just suggest that if they are alive, you too can be alive. So thank you very much and God bless you all. Thank you.
Thank you.
Thank you. Goodbye, everybody. Thank you for joining us today.
Goodbye.
We really appreciate you.
Thank you.
Bye.
Bye, everyone.
Bye.